So basically, we had this young chap who was on citalopram tablets for depression and anxiety. He had been taking it for over a year, and he had came off the antidepressants in the last 10 days due to various changes in his life, having a new job and other changes, which meant that he does no longer need to be on antidepressants. However, coming off the antidepressants, in the last 10 days, he has felt faint, dizzy and confused with a heart beating fast, as well as ringing in his ears 24/7. So he had to go back on the tablets while seeking professional help. So in addition to these withdrawal symptoms that he mentioned, which was the feeling faint, dizzy, confused and ringing ears known as tinnitus, there are other withdrawal symptoms some people might experience with antidepressants, such as feeling restless or agitated, more anxious, having sleep disturbances where you might have nightmares, for instance, feeling more sweaty, and some of these symptoms can last for a few weeks. Now usually when we start patients on antidepressants, we normally advise to be on it ideally for a minimum of 6 months, because what antidepressants does, it alters the chemical balance in the brain. So for example, you have the selective serotonin receptor inhibitors such as the citalopram, for instance, and what it does, it increases the level of serotonin in the brain. However, if you come off too quickly, you might have what we call rebound depression, where your depressive symptoms are actually worse than they were before you started the medication, which is why we advise still on it for a minimum of 6 months. Even though you're feeling better by the first month, be on it for at least 6 months, so that when you come off it, you're not going to have any risk of rebound depression or risk of a relapse of your depressive symptoms. So in terms of the scenario that we looked at, where this gentleman was on 40 milligrams of citalopram, how would he wean himself off the antidepressants? So usually there are different ways of doing this, because there's no actual science. Coming off antidepressants is actually an art in itself. So if you remember, when you start antidepressants, you start on the lowest dose and gradually you titrate it according to the dose at which your symptoms start to respond to the medication. For citalopram, if you're on 20 milligrams, it might be 20 milligrams is sufficient for you, or it might be that it's not controlling the symptoms as well as you would like, so some people increase it to 40 milligrams. Now 40 milligrams is the maximum dose of citalopram that you can take. Usually when you're on 40 milligrams of citalopram, you're advised to remain on it for 6 months as advised. Maybe after 6 months, if you feel better and you want to come off the medication, you cannot stop 40 milligrams abruptly, because if you stop it, most likely you would have these withdrawal symptoms that we mentioned. So what you need to do is you need to wean yourself gradually of the citalopram. So starting on 40, there are different ways of doing this. You might want to go down to 30 milligrams. So to go on 30 milligrams, you need a 20 milligram and a 10 milligram tablet. You go on 30 milligrams for 4 weeks. After 4 weeks, you reduce to 20 milligrams. You can also choose to skip the 30 milligrams and go straight from 40 to 20 milligrams, because in some cases, when you're increasing the medication, you can actually go from 20 to 40 milligrams, or you can go from 20 to 30 to 40. Equally, you can go 40, 30, 20, or you can go 40 down to 20. You're not going to have any withdrawal symptoms when you go from 40 to the 20 milligrams of citalopram. So you want to stay on 20 milligrams of citalopram for about a month. After a month, you have the option of stopping the medication, or you might want to take 20 milligrams on alternate days, which would be Monday, Wednesday, Friday, and Sunday, for instance. And then after a month of alternate days, then you stop the medication. Or alternatively, if you're under 20 milligrams of citalopram and you stopped it, and after stopping it, you're having withdrawal symptoms which go on for more than 2 weeks, you can then go back on the 20 milligrams and stop it more gradually, where basically you take 20 milligrams for a month and then you now reduce it to 10 milligrams for a month. So 10 milligrams would be taking half a tablet of the citalopram. So after taking 10 milligrams for a month, you can now choose to go on the same half a tablet for alternate days, where you take it every other day as I suggested, and then you stop the medication. So it could take you 2 to 3 months in total to come off the antidepressant. Now, if you do have withdrawal symptoms after stopping the antidepressant, bear in mind that the withdrawal symptoms are not meant to last for more than 2 weeks, so they could last for 1 to 2 weeks. However, we normally advise to persevere, or if they last more than 2 weeks, we normally advise go back on the lowest dose of the antidepressant at which you did not experience the withdrawal symptoms. It might be 10 or it might be 20 milligrams, which means you will need to be on this medication for longer. So rather than being on it for 4 weeks, you now need to be on it for 8 weeks and have a more gradual reduction of your antidepressant. weaning is specific to the individual. A weaning process that works for one person might not work for the other. So for example, someone can go from 40 to 20 and then stop and they're okay with no withdrawal symptoms. Another person can go from 40 to 20 and have withdrawal symptoms. So some people might need to wean off gradually. So it's not a case of one size fits all, which is why I'm saying there's no actual science to this. It's a bit of trial and error, mix and match and seeing what works for you in terms of gradually weaning yourself off the antidepressant. And before you stop or try to wean yourself off the antidepressant, you always have to seek advice from your doctor, as you need to be monitored, especially if you have risk of your depression coming back or even your anxiety symptoms which will return after stopping the medication.